iteration of the same fact that animals may be fed antibiotics for a variety of reasons. They may be fed antibiotics for prophylaxis, that is prevention of infection. They may be fed antibiotics for treatment of infections. They may be fed antibiotics, I understand, what is called growth promoters. Okay, there is also a term called metaphylaxis, I understand. Now, whenever you use antibiotics for whatever may be the purpose, certain proportion of bacteria gets killed, but certain proportion survives. And those that survive, there is a possibility of developing resistance in those residual bacteria. And the residual genes of antibiotic resistance may be passed on to humans through a variety of different ways. So that is the message from this figure. Next slide, please. Now, people have tried to see that in terms of global antibiotic use, what are the different interventions which can actually decrease the antibiotic usage in animals. So first, let's say, if you do not do intervention, your effect on antibiotic use is 200, let's say. Now, if you cap the antibiotic use to 50 milligram per kg of the animal, it is significantly reduced. If you reduce your meat consumption to 165 grams per day, that also has an effect. If you introduce a system of taxation, that has an effect. And if you use a combination of these methods, those also have an effect. So this shows that the effect of antibiotic and the exposure to the antibiotics in the animal population and consequently to the humans can be reduced by economic measures, can be reduced by dietary measures, and can be reduced also by particular veterinary practices or a combination of them. So this is a very important graph actually showing the effect of interventions on the overall usage of antibiotics. Next slide, please. Now, as I said that antibiotics may be used in animals for treatment, control of infections, prevention of infection, but also as growth promoters. Next slide, please. Now, you may classify all the antibiotics into three different types. So, one are antibiotics which are exclusively used in animals. There are also a group of antibiotics which are exclusively used in humans. But there is also a group of antibiotics which may be used both in humans and animals. And that is the red one. Next slide, please. And this is the group we are most concerned about in terms of both human health and in terms of both animal health. Because there are dual uses of these antibiotics and cross-resistance between the species, particularly between humans and other animals, can become an issue in this category. Next slide, please. Now, this is another graph which shows that resistant bacteria, how it actually develops and how it flows. So you can see that there are, when certain bacterial resistance develops, it is not that in all cases there will be human-to-human transmission. Human-to-human transmission is one phenomenon, but it is not always the case. So, scenario A is resistant bacteria not adapted to human transmission. Second is resistant bacteria capable of human transmission. And the third is transfer of resistant genes. Now, we have to remember that resistance may pass from human to animals or from animals to humans or from animals to humans in variety of different ways. So it may be by the passage of the bacteria or it may be by the passage of the resistance genes. Both are important. So unless we know that these mechanisms exist, we will not be able to actually control the problem of antibiotic resistance effectively. Next slide, please. Now, the factors affecting microbiome in animals and humans. Now, those of you who work with microbiome will know that any particular anatomical niche in an animal or a human may have a particular microbial population. Let's say the gut of the humans, let's say the gut of the animals. It may be the skin in some cases. It may be the mouth. So there may be variety of different anatomical areas of the body of the humans or animals where microbes may exist. But the composition of the totality of the microbiome is dependent on many, many factors. So for example, in humans, the diet is a factor, medicines are a factor, age is a factor, obesity is a factor, pollution is a factor, water is a factor, there are environmental factors and many disease-related factors. Likewise, in animals, there are many factors. Now, understanding the totality of the microbes through a study of the microbiome becomes important because, as you know, that the gut is a reservoir of a huge number of microbes. In fact, a gram of stool may have up to 10 to the power 11 or 12 microbes. And even a fraction of them, if they become resistant, that has a huge effect on the ecology and the transmission of resistant pathogens. Next slide, please. Now, this is a list of antibiotics where they may be used in human health and sometimes in animal health. So, used in humans for a variety of reasons. You have chloramphenicol, tetracycline, neomycin, nalidixic acid, kanamycin, penicillin G, sulfonamides, ciprofloxacin, gentamicin, cephalothrin. But you can see that there are certain of these antibiotics used in human health which are also applicable for animal health for a variety of different reasons. And the slide that I showed that there are antibiotics which have got dual applications both in humans and animals become particularly relevant. This is not a complete or an exhaustive list, but it gives you an understanding that there are certain antibiotics which have got dual use in both humans and animals. Next slide, please. Now, the figure of antibiotics. So as I was saying, that the proportion of antibiotics that is used in humans and animals, it is not cast on stone. It varies from country to country. Now here is an example. I showed a graph from USA where 70% of the antibiotics were used in animals. Now this is a graph, a pie chart from UK where 64% of the antibiotics in that country are used in humans, just the opposite. So there are situations where humans are consuming more, or in other words, the animals are consuming less. So if you want to control, there are countries, there are examples where you can do farming with using less antibiotics. Next slide, please. Now this is a list of countries, and as you can see that the antibiotic use in agriculture varies greatly by the country. So it is not something that you cannot do farming without antibiotics. So there are examples of countries, many examples of that, which are doing farming extensively without using a significant amount of antibiotics. Next slide, please. So now what happens if antibiotics are used in that much amount? So the problems are many. For example, take a drug like colistin. Colistin is a drug, colistin is an antibiotic which has become very, very important in the era of multi-drug resistant human infections. Now, because of its use in the treatment of multi-drug resistant gram-negative infections, when we started using it in the human health, we found that after a period of time, colistin resistance was also being noticed. Now, are they de novo resistance or in humans, or are they resistance which is transmitted to humans from environmental sources or food sources? So that is the question. So it has been seen plasmid-mediated colistin resistance in animals, current status and future direction. So this is a paper, and there are more papers which actually show the problem of colistin resistance both in humans as well as in animals. And colistin is an important drug which is used in human health, and is obviously an important drug which is used in animal health. So next slide, please. So you can see that there is another antibiotic called vancomycin. Now vancomycin resistant enterococci can cause human infections also. And these infections, but there are several types of vancomycin resistant enterococci. The first two, the Van A and the Van B types, are the most commonly found in human infections, but there are other Van types. And you can see that vancomycin is a drug which is also used in the veterinary sector, and consequently there is a generation of VRE or vancomycin resistant enterococcus which may be inadvertently passed on to the food chain and cause human infection. Next slide, please. Now this is a matrix which shows the close interaction of the humans, the vegetables, the farm animals, the wildlife, the food processing industry, the pets, the environment, and all of the ecological niches which are interacting in a very dynamic manner with each other. So it is not a single pathway of transmission. It is multiple pathway of transmission which is coexisting simultaneously, and when an individual is there or an animal is there, they are subjected to a variety of different influences from many sides. Next slide please. Most domestic livestock causes colistin-resistant commensal E. coli harboring MCR in the rural community and field. So this is something to be alarmed about in the era where colistin use in human health is very common. Next slide please. And this is a table which shows the proportion of colistin resistance that was detected in the livestock population. And you can see the proportion is pretty high. It is over 90% in all these cases. Although the sample size is low, but there is significant proportion of livestock which is showing colistin resistance and harboring the colistin resistant MCR1 gene which is carried in the plasmid. Next slide please. Now what is the Indian Council of Medical Research doing with regard to the human health aspect? Now this is from the ICMR's website on antimicrobial resistance surveillance and research initiative. And you can see that in that side there is a description of about 20 centers for antimicrobial resistance surveillance which ICMR has set up in different parts of the country, and our hospital happens to be one of these 20 centers. And there are guidelines related to SOP for bacteriology for humans, SOP in bacteriology for the veterinary sector. So obviously, when you do antibiotic sensitivity for animals, you cannot have the same method, you cannot have the same breakpoints, because the pharmacokinetics is going to be very different in humans and animals, and that has been taken care of in these bacteriology SOPs. Next slide please. Now these are the location of the various nodal centers as well as the various regional centers which ICMR has developed over the last 4 or 5 years to monitor the problem of antimicrobial resistance in the country. Next slide please. So these are the list of nodal centers. They are in Christian Medical College, Vellore. They are there in All India Institute of Medical Sciences, New Delhi. They are in Postgraduate Institute of Medical Education and Research, Chandigarh. They are also a center in Jilmar, Pondicherry. But please remember that antimicrobial resistance is not just a problem related to bacteria. It has become a problem related to fungus also. So there is the Chandigarh Center which is looking at fungal infections and antimicrobial resistance, and I'm sure there are stories about antiviral resistance and antiparasitic resistance which we have not covered. So this is the annual report from the last year, taking the data from 2018 January to December, which is freely available, and look at the problem of antimicrobial resistance in the Indian population, which ICMR has published, taking the data from all the 20 centers that is across the country. And these are the different antibiotics to which resistance has been seen, and you can see that colistin, which has become the most important antibiotic with regard to treatment of drug-resistant infection, the sensitivity is not 100%. It is actually 100% only for one organism over there, which is Citrobacter. But in case of Klebsiella, which is one of the most deadliest organisms in human infections, human bloodstream infection, it has come down to 91%. So you cannot take colistin, even colistin, for granted for the treatment of serious gram-negative bacterial infections. Next slide, please. Now, the problem of antibiotic resistance in humans starts from birth. So, just for your information, 1 million Indian children die in the first 4 weeks of life each year. 1 million. So the number is 10 lakhs. It's an astonishingly high number. Of these, 1,09,000 are caused by sepsis. So these are serious forms of infection. So sepsis is a clinical syndrome where in addition to having infection, there is organ dysfunction. So about 20% of the deaths that occur in the neonatal period, in the first month of life, are caused by sepsis. And 58,000 of them, or just over 30% of the neonatal sepsis deaths, are attributable to antibiotic resistance. So you can understand that's a huge proportion of life. Even in the first month of life, is lost because of antibiotic resistance. So antibiotic resistance kills not when you're already grown up. It starts killing from the very early age, from the time the baby is born. Next slide, please. So this is a projection of the current scenario and the projected scenario which is likely to happen if we are unable to do something with regard to control of antimicrobial resistance. Currently about 700,000 people die of antimicrobial resistance every year. The number, so that is 7 lakh. The number is projected to rise to 1 crore every year by 2015 unless the problem is contained. Next slide, please. And there is the economic cost of it. So it is projected that by 2050, so in 30 years time, unless we are able to control the problem, 1 crore people will die every year because of antimicrobial resistance. So the current death rate, global death rate is about 6 crore. Every year 6 crore people die. Okay, so, but it is projected. So even if 10 crore people die in 2050, every year, 1 crore, that is 1 out of 10, would be because of antimicrobial resistance. So that's the seriousness of the problem, and there is an economic cost associated with it. Now this slide shows something political and something social. So there is a correlation between corruption and antimicrobial resistance. So this was a European study which shows that if a country has a great control over corruption, then its antibiotic resistance is low. If it is a very corrupt country, its rate of antibiotic resistance is high. So antibiotic resistance is not just a scientific problem. Antibiotic resistance is a social problem. It's an administrative problem. So that has to be taken. It is a governance issue as well. So those countries which have got excellent administration, excellent governance, free of corruption or very low corruption, they have a better chance of combating antimicrobial resistance. Next. Now this is the effect of antimicrobial or inappropriate antibiotics in human health. Antibiotic resistance often leads to delay in giving appropriate treatment. And it has been seen that every hour delay in giving appropriate treatment in a septic patient who is in septic shock in an intensive care unit increases mortality by 7%. So if the delay in treatment is for 10 hours, the chances of mortality has increased by 70%. So that's the simple message from this graph. This is a very important paper. The first author is an Indian, and it has been quoted innumerable times in various medical literature. Next slide, please. Now what are we doing? So in Jana Medical Center, what we have tried to do is develop some low-cost tests to perform antimicrobial susceptibility testing by genotypic method. Because you know, although our country is big, we have so many scientists, we actually manufacture very few kits on our own. We've manufactured very few kits on our own. Most of our machines are not made in India. Most of our reagents are not made in India. Okay, although I believe that we have the capability to do that. If we can send rockets to Mars and Moon, if we can explode an atomic bomb, if we can develop genetic drug industry, if we can do Operation Flood with regard to milk, and if we could have done the green revolution in case of agriculture, we can certainly manufacture machines, we can certainly develop our own tests. Now if you want a good quality pipette, it has to come from Germany or US. Pipette tip. You don't have to go anywhere else. Okay?
So you can make your cases.
Yes. So to summarize my conclusion, there are many tests we have developed. There are two I would like to mention. One is for the early detection of carbapenem resistance by PCRs and early detection of MCR genes by PCR. And these are fraction of the commercial costs. Next slide, please. So this is the mortality rate from various infections, and you can see that the mortality rates are 40, 50, 60%. Now these mortality rates are in days. So if somebody has cancer, the cancer mortality rate is measured in years. 3-year mortality, 5-year mortality, 10-year mortality. When you have an infection, the mortality rate is measured in 30 days. So if you have a gram-negative sepsis, as for example, gram-negative sepsis in critical care, 44% mortality rate. So if there are 100 patients of gram-negative sepsis, at the end of 30 days, 1 month, 44 of them will die. So that is the gravity of the situation. Next slide, please. So this shows the cost of antimicrobial treatment. So this is the daily cost and this is the 7-day cost. And many a case, if you look at this cost, there are many patients in intensive care unit, in our hospital, in other corporate hospitals, and maybe sometimes in government hospital, where the total cost of antibiotics per day is close to 50,000 rupees. 50,000 rupees per day. Okay. So if it is 10 days, 5 lakh is lost just by antibiotics only. And the patient survival rate is 50%. Next. Now the quality of the antibiotic is also very important. So it is if you are giving 4 grams, is it really 4 grams? Or is it 2 grams? Or is it 3 grams? Or is it more than that? Are there impurities? Are there contaminations? Are there chemical contaminants? Are there microbial contaminants? So we did a study to see what is the quality of the antibiotics that we are giving to human patients. And we found that not all antibiotic brands are actually same. These are published data. That sometimes when they are saying 4.5 gram, actually it is 3 grams. Okay, next slide please. Next slide please. So this is my final slide. That in order to combat the problem of antimicrobial resistance, various agencies of the government has to work together. This includes the Indian Council of Medical Research, this includes the Department of Animal Husbandry, Dairy, Fisheries, it includes the Drug Controller General of India, and it includes the Indian Council of Agricultural Research. So we have to realize that the health of human beings or the animals cannot be saved unless we are looking about each other in an integrated manner. Thank you very much.
Thank you, Dr. Sanjay Bhattacharya.